Hello. In this vignette, we'll be talking about basic airway management. I'll cover head position, correct application of the mask, correct head placement, ventilation, and managing an obstructed airway. So, starting with head position, most of the time your patients will come in a somewhat neutral position. I'm going to put this head down just a little bit. So here's a patient in a neutral position, and to help us out getting a better open airway, we can do a couple of maneuvers to help us out. One thing we can do, if your patient has a suspected C-spine injury, we can do a jaw thrust maneuver. The jaw thrust maneuver, I'm putting my fingers behind the mandible and I'm pushing upwards on the jaw to open the airway. If your patient does not have a C-spine injury, one of the best ways to do is a head tilt chin lift. With a head tilt chin lift, I'm going to place my fingers on the mandible, lift the head back a little bit, and I'm going to open his airway. That way it'll provide maximum opening of the airway, moving that soft tissue to open the airway. From here, I'm going to take our mask, which has been inflated already, and I'm going to place the bridge of the apex of the mask on the bridge of the patient's nose, and it just covers towards the bottom of the chin. I'm going to place my fingers in a C position, the thumb being across the bridge of the nose, the fingers across the bottom, the chin portion, and the other three fingers are going to go on the jaw. And from here, downward pressure with the C and a little upward pressure with your fingers. From here, I should be able to see condensation on my mask, and as the patient breathes in and out, I can see my bag going up and down. So for ventilation, I'm looking for a rise and fall of the chest, humidification on my bag, and the feel of the bag as I ventilate. Looking back on my machine, I can see end-tidal CO2. Now, if there's an airway problem, I have my oral airway available. And with the oral airway, the thing I will do, I will open my patient's mouth with my fingers. I will use my tongue blade, slide it down, pass on the patient's tongue, push forward and lift a little bit, and just slide my airway down, and it will fit in place like so. If I'm using the nasal airway, I'll have it lubricated, and it's measured like so from the nose to the tip of the ear. I'll lubricate it, pull the nose back a little bit, bevel to the septum, slide it in with a little twist, and it'll go down into place. Once that is done with a nasal airway or oral airway, I will check my ABCs, put my mask back in place, look for a rise and fall of the chest, look for condensation on my mask, feel the bag, and end-tidal CO2. If need be, if we have anything in the mouth, like blood or vomitus, I have my suction available here, and I can suck the patient's mouth out. Once that's done, reapply the mask and check ventilation. So, in this basic airway management vignette, we've covered head position, application of the mask, correct placement of the mask on the patient's face, ventilation, and managing an obstructed airway.